Hello there, welcome back to Fem Health Talk with me, Kellen Budoni. And in today's episode, I'd like us to talk about menstruation and menstrual hygiene. We are going to talk about what constitutes normal menstruation, what causes irregular periods, what diets should we observe during menstruation. We are going to look at three menstrual products that women usually use. And finally, we're going to talk about period poverty, understanding what it is and what we can do to eliminate period poverty. So, menstruation comes with different names. People call it menstruation, menses, periods, and flow, MP3, you name it. But this is basically the period that the endometrium wall sheds because the ova was not fertilized. And it is characterized by different physical and emotional changes that we looked at in the previous episode. Yes, and during menstruation, a woman experiences bloating, or rather kufura tumbo. Some women experience diarrhea or loose stool. Others experience very painful nipples. Others experience cramps. And cramps basically means that you feel pain on your lower abdomen, around the pelvic area. And this is because the uterine wall is contracting to shed the endometrium. So if cramps are painful to that level that you cannot go to work, you cannot function, you just need to take medicine, it is very important to go and visit a physician because very painful cramps are a sign of some reproductive health conditions such as endometriosis and uterine fibroids. So if at all you experience those severe menstrual cramps, like you cannot function, you just sleep. Other cramps, you even feel them at the back. Others you feel like it's an electric shock that passes in between your butt crack. I know, ladies, you know what I'm talking about. So if you experience those extreme cramps, it is very important to see a physician. So there are three common ways to relieve menstrual cramps. The first one is the heat method. This is why you take a heating pad or a bottle and put hot water, but not extremely hot, somewhat warm to hot water, and then you place it on your lower abdomen. So this functions to soothe the muscles and it relieves menstrual cramps. So the second method is massaging. So you're going to gently massage your lower abdomen using deep and circular massages. So basically that increases blood flow to the veins to allow shedding of blood, and it also relieves menstrual cramps. And finally, if those two methods do not work, you can take painkillers. You can go to the nearest pharmacy or chemist and tell the physician that you are experiencing menstrual cramps, and they're going to give you anti-inflammatory drugs. And they're also going to give you painkillers and also take them according to the dosage. So, what causes irregular periods? Irregular period means that you're not pregnant, but you have not gotten your period in over a month, or you're supposed to have your period in, let's say, 28 days, and you find yourself bleeding in between periods. Let's say you've gotten your periods this week, and then you're expecting your next period in 4 weeks, and then you get it in 2 weeks. Irregular period also means that you have gotten your period for more than 7 days. So that is what constitutes an irregular period. And there are several factors that cause these irregular periods, and I would like us to look at them. Factor number one is hormonal changes. Hormonal changes meaning that if you are premenopausal or approaching menopause, that is, you are in your late 40s, early 50s, and in your 50s, basically you're going to start experiencing such irregular periods because your body is approaching menopause or your body is already in menopause, so you'll get irregular periods. Number two, if you're using hormonal contraceptives, if you're using the pills, the injection, the implants, we're going to talk about this in details in the future, but hormonal contraceptives also alter your cycle, so you're going to have these irregular periods. Number three, if you have thyroid dysfunction, thyroid is this glands, or what we refer to as gae in my mother tongue. If there's a dysfunction in the thyroid hormones, you're going to experience those irregular periods. And finally, under the hormonal changes, if at all you are breastfeeding, meaning that your body is producing the hormone prolactin. Prolactin inhibits the process of ovulation, and so the egg is not produced, and again you start having those irregular periods. It is very, very normal when you're breastfeeding and not get your regular periods. So the other factor is lifestyle factors. If you are under extreme stress, you're going to experience irregular periods. Again, for those women who have eating disorders, either you are extremely anorexic or extremely obese, those women experience irregular periods. And finally, extreme exercise. If you really strain your body in the gym, you're going to experience irregular periods at some point. So the third factor that causes irregular periods is health conditions, and we are going to talk about them in details in the future. And these health conditions include endometriosis, PID, or what we call pelvic inflammatory disease, women with PCOS, or what we call polycystic ovarian syndrome, women with POI, or what we call primary ovarian insufficiency, and women with cancer will experience irregular periods. And we're going to talk about this in details in the future. The fourth factor that causes irregular periods is medications. Again, women who are on antipsychotics, antidepressants, women who are undergoing chemotherapy, and women who take these blood pressure drugs. Again, those medications interfere with your normal hormonal functions and you get irregular periods. Finally, another cause of irregular periods is uterine growths, and these are not cancerous growths. So what we call fibroids or polyops, we're going to talk about this in details. So women who have fibroids or those uterine growths usually experience irregular periods. So it is very important to be self-aware and know that I'm experiencing irregular periods, and you need to go to the doctor and tell them, hey, I am not on any hormonal contraceptive, I am not breastfeeding, I am not on this and this and this, but I'm experiencing irregular periods. So what could be the cause? Let's talk about diet during menstruation, because it is very, very important. Number one, you need to stay hydrated. Drink a lot of water, more than 1 liter a day. It replenishes the fluids that you're losing in menstrual blood. Number two, take foods rich in iron. Again, the blood that you lose is rich in iron. So if you do not take food rich in iron, you're going to start experiencing dizziness. Yeah, so foods rich in iron examples are spinach, lentils, or what we call kamande, lean red meat, fish, foods basically rich in iron. Also take foods rich in vitamin C, because it helps in absorption of iron in the body. That is the citruses, the lemons, the oranges, tangerines. Those citruses help absorption of iron in the body. So foods to avoid or limit during menstruation: number one is caffeine or coffee. Number two is alcohol. Number three is salty, sugary, and processed foods. Basically these foods worsen the negative symptoms during menstruation. They worsen the cramps, they worsen bloating. So it is very important to limit or avoid these foods during menstruation. So the following are the different menstrual products that I want us to look at today. And the first one is the sanitary pad. The second one is the tampons. And finally, we have the menstrual cup. The pad is the most common menstrual product in the market. And this is a disposable pad, meaning that after use, you can dispose it or throw it away. There are those pads that are not disposable, meaning that they can be washed and reused in another menstrual cycle. The pads come in different sizes depending on the woman's flow. So those thin pads are for women with light flow. There are those normal pads with normal thickness are for the women with normal flow, and there are those thick, what we call maxi thick. Some of them are called super, for the women with heavy flow. Heavy flow meaning that you can fill up a pad within a few hours. So there are those thick pads for women with heavy flow. And this is how to use a sanitary pad. I know most of us know how to use them, but this is for the adolescent girl or for anybody that might not know how to use a sanitary pad. This is how to use and dispose a sanitary pad. The majority of them come in a wrapping like this. So what you're going to do is unwrap the pad. So once you unwrap it, it looks like this. This is how the inside looks like. And again, it is very advisable to go for those pads that have a cotton feeling on the inside, or rather the inside is cotton. Avoid those pads that have a nylon feeling, that nylon paper feeling, because it's going to cause irritation and inflammation during your menstruation. So the front looks like this and the back looks like this. And the back has a wrapper, actually two. There's the outer wrapper and there's this inner wrapper that is covering the adhesive side, or the side that has the glue. So what you're going to do is you're going to pick the pad, and you have now your panty. Don't worry, this is a very new panty. And you're going to turn your panty on the inside out like that. And you're going to turn your panty on the inside out like that. And you're going to take now the pad and peel off the wrapper, and take the pad and place it on the middle of your panty like this. Like that. So it's going to stick on the pad. I wish I'd used a different colored panty because it just looks white, but I hope you can see. Then you're going to peel off the second wrapper. It's covering the wings. The wings basically are to secure the pad on the panty. So you're going to pick one wing and now place it towards the back. Then pick the other wing and place it towards the back. And it stays on the panty like this. Sorry, like that. And now you wear the panty with the pad in the middle. The sanitary pad should be worn between 4 to 8 hours. Do not wear a pad for more than 8 hours, otherwise you're going to get those bacterial infections. So this is how you dispose of a used pad. So here I have water that I dissolved purple dye, and I just want to demonstrate how to dispose of sanitary pads. So let's assume that this is the used sanitary pad. How do you dispose it? You do not just throw it away looking like this. It is not very sanitary and hygienic. So what you're going to do is fold it in half, like so, and then fold it in quarters, like so, and then fold it again, like that. And you're going to have that glue, stick together like that. You can also bring now the wings towards the center like that. And this is how you're supposed to dispose a pad looking like. So you pick your tissue paper and wrap on the used pad, and now it's ready to be disposed. If at all you do not have the tissue paper, you're also going to have the wrapper to the new pad that you're going to be changing. That outside wrapper, this one, for the new pad that you're going to be putting on. So if you don't have the tissue paper, take the wrapper and now put the used sanitary pad like that, and now it's ready to be disposed. The next product I want us to look at is the tampons, and this brand looks like this. And again, the tampons come in different sizes and diameters depending on the flow. This brand has a line of weakness, so you're just going to twist open to remove the tampon. And this is how the tampon looks like. It has a string and it has a head. All right. So this is how to insert a tampon because it goes in your vagina. You're going to squat or place one leg on the toilet or one leg on the bed if at all you are putting in the tampon in your bedroom. And you're going to lean slightly forward, and then you're going to insert this head inside the vagina. Insert it and push it, and then feel whether it's comfortable for you. This string now is left on the outside because once it starts absorbing the blood, this is what you're going to use to pull the tampon. Again, here you have the purple dyed water to demonstrate how the tampon absorbs the blood during menstruation. And you can see how small it is. And once it absorbs the blood, it expands in diameter like this. Don't dispose the tampon looking like this. It's not very hygienic or sanitary. So you're going to pick your tissue and you're going to wrap it on the tampon like this. And again, you're going to dispose it in the sanitary bin. So one thing I must mention when using the tampon, do not use the tampon for more than 8 hours. Otherwise, you're going to predispose yourself to what we call toxic shock syndrome. So finally, we have the menstrual cup. And this is a newer product in the market. Not many people are conversant with the menstrual cup. It looks like this. It has a rim. It has a funnel-shaped body, and it has an end or a tail. Yeah. So this is how it looks like. These menstrual cups come in different sizes in terms of diameter and the capacity that they can hold. They also come in different colors. This is the clear one. There are pink, there are purple ones, and it is made out of medically grade silicone. This is not plastic, right? Most of them are made from silicone. Some are made from rubber, but some people have latex allergies. So most menstrual cups are made out of silicone, and this is how to use a menstrual cup. So before inserting the menstrual cup, you have realized that your period has come. So before inserting your menstrual cup, this is how you prep it. Number one, boil water and then place it in an airtight container, and now place the menstrual cup in the boiled water for 5 to 10 minutes. This is just going to sterilize the menstrual cup. Do not wipe the menstrual cup with tissue. Do not wipe with disinfectant. Do not wipe it with wet wipes, because that is going to be introducing bacteria into your genitalia. So the best way to clean the menstrual cup is to boil it, or boil water, place the menstrual cup in the airtight container and let it rest for 5 minutes. You cannot put it when the rim is open like this, right? So there's two simple methods. So the first one is you pinch the rim together like this, and then you form a C or a U shape. Sorry. You form a U shape like that, or a C shape. I am just pinching the rim. I hope it's visible. The next method is pushing the tip of the rim to the floor of the funnel like this, and then pinching it. Then pinching it. So it's going to look somewhat like that. Right? So again, the menstrual cup goes inside your vagina. So once you form this shape, or the C shape or the U shape, you're going to assume a comfortable position, right? So you can either bend forward or squat, or place one leg on the toilet or one leg on the bed, depending on the location that you're putting in the menstrual cup. So you're going to pinch the body like this, and then you're going to insert it in the vagina. And then you're going to push it and push it until you feel comfortable, and then you're going to release, and it's going to open. So once it opens in the vagina, it's going to create a vacuum seal, meaning that it's going to create a suction and it's going to remain on the wall like that. It will not fall out or fall down. So this part remains slightly on the outside. Assuming that this is a menstrual cup and it has collected the menstrual blood, yeah? And this is how, let's say, it looks like in the vagina. So you're going to assume a comfortable position and make sure that your hands are clean. That means you have washed your hands with soap and rinsed your hands. So you're going to take these two fingers and you're going to pinch the bottom of the menstrual cup. It's going to break the vacuum seal, and now you can hold it tightly like this and now remove it. So what you do is now take the contents and pour them inside the toilet and reinsert it. Do not wipe the menstrual cup with tissue, otherwise you're going to be introducing bacteria to the menstrual cup. So just reinsert it. As long as your hands are clean, you can just reinsert it. So these two products, unlike the sanitary pad, are not very common. Yeah, people prefer the tampon, especially when you're doing physical activities like swimming. Maybe you're going to a sauna or a steam bath, or you're going to the gym. Most women prefer using the tampons, and they also are more costly or more expensive than the sanitary pad. The menstrual cup is a relatively new product, like I said, and this product can be used for up to 10 years. So it is very environmental friendly. You can imagine the pieces of pads that you have used or you have been using since you first got your period, and you can use this menstrual cup for up to 10 years. So this is very environmental friendly, and most people are now using the menstrual cup. So finally, let's talk about period poverty, because many women and girls in low and middle income countries or areas, they experience period poverty. Period poverty basically means that the girls or the women do not have access to menstrual products, menstrual hygiene facilities, or even education around menstrual hygiene. And this is due to most of the cases extreme or rather high poverty levels. The cheapest menstrual product in the market right now is a sanitary pad, the disposable sanitary pad. And the cheapest one right now goes for around 70 shillings. So some women and girls cannot afford that 70 shilling to buy one packet of disposable sanitary pads. And what this leads to is, number one, absenteeism in school, because if the girl does not have these pads or menstrual products, they will not go to school. Period poverty also brings stigma, meaning that once you're not seen in public, you know, everybody already knows that you're on your period or you are unclean, and this brings such shame and stigma to the women and girls. Also, period poverty brings infection, because if a woman does not access safe menstrual products, some women even share menstrual products. Let's say they have a piece of cloth or blanket that the sisters are sharing, or friends are sharing, or the mother and daughters are sharing. This can cause and lead to infections. Many individuals and organizations have come together to help sort of eliminate period poverty. So the question is, how can you get involved in ensuring that a girl and a woman somewhere is not affected by period poverty? Number one, you and your youth group or your church group or your basically community of friends, you can purchase the disposable pads in cartons and distribute them to schools, and the teachers in the school can now give these disposable pads to those girls that need them the most. Or you can look for a local organization around you that supports menstrual hygiene and see how you can help. Thank you so much for staying to the end. I know we have been empowered with knowledge and information about menstruation, menstrual health, and menstrual hygiene. I will see you in episode 4. Thank you so much.